Hi, this is Dr. Gary Sykes, and in this vlog I'd like to consider the topic of perineal tearing. Every woman who gives birth does not want to tear. She likes her perineum to remain intact. Well, what factors are important making a woman more likely to have perineal tearing? The first I think to consider is the elasticity of her tissues. Some women have more stretchy perineums, vaginal tissues than others. Some women it's more tight, and if a woman it is more tight, then they're more likely to sustain a tear. That's just one of those genetic things. Certainly it's certain ethnicities are more prone to tearing. Asian, particularly Indian, are more likely to people of those ethnic backgrounds are more likely to have nasty perineal tears, and we're very, very conscious of that. How long you've been pushing is relevant. If a woman is pushing for a long time in the second stage, that results in edema of the tissues, and when you get fluid in tissues, they lose their strength, and so they're more likely to tear. The position of the baby's head, that's extremely relevant. If the head is well flexed and in an occipito anterior position, then there's less likely to be tearing. If the head is more deflex, which is what is associated with an occipito-posterior position, and particularly if the baby comes out still in that occipito-posterior position, then there's a bigger diameter presenting, a larger diameter stretching the vaginal entrance, and so more likely to be tearing. Whether or not there's scar tissue there from previous deliveries. So if there's a lot of scar tissue, a woman is more prone to tearing because scar tissue is not as strong as tissues which are not scarred. So that's an important consideration. The competence, the experience of what we call the accoucheur, the person who does the delivery. So if your delivery is being done by someone who's quite junior, a trainee, that are not well able to understand how to control the head, protect the perineum with the delivery, then you are more likely to have a more significant tear. So the more experienced the accoucheur, the less likely you are going to have significant tearing. Very, very important. The speed and the control of the delivery of the baby's head. So some women without an epidural get this incredible desire just to bear down, and they just push and the baby's head comes out very, very quickly. So that it's impossible to protect the perineum, and so they're more likely to have a more nasty tear than otherwise would have been the case. Whether or not you have an epidural. What an epidural does is when a woman is pushing, it takes away that incredible desire to bear down. So it's a much more controlled push. It's a much more slower stretch of the perineum. And so if there is an epidural, a woman is much less likely to have significant perineal tearing than otherwise would be the case. Whether or not you have an operative vaginal delivery. I prefer a vacuum cup to forceps, because a vacuum cup is placed on top of the baby's head, whereas forceps are at the side of the baby's head. So with a cup, there's no extra stretching of the vaginal entrance, and so there's no reason why there should be more tearing than would be the case if you had no operative vaginal delivery and push the baby out yourself. Forceps increase the width of the baby's head by being placed at the side of the baby's head, so there's greater stretching of the vaginal entrance. Because there's greater stretching, there's more likely to be significant tearing. And personally, I've done many hundreds and hundreds of forceps deliveries, and I've always been the opinion if a woman is going to have a forceps delivery, then she should have an episiotomy to avoid a nasty tear. Well, what can you do to minimise the likelihood of having a significant tear? Well, we obviously can't change your ethnicity. The other things I've mentioned about epidurals and so forth, certainly give them consideration. Perineal massage is advocated by midwives, and also popular is the use of the Epino. Both of these are what I would call controversial. In other words, they don't have the good randomized controlled trials to prove they're very in great benefit. With the Epino, there are certain studies which say that it's a great benefit, and other studies which say it's of no benefit at all. Certainly, though, they won't do any harm. So if you want to do perineal massage or use the Epino, certainly I'm not objecting to it at all. But you have to do it very conscientiously. There's no point doing it every now and then. You have to do it conscientiously in those last weeks of your pregnancy. But that may help. The other comment I'll make, if I suspect a woman's going to have a nasty perineal tear, then I'll prefer to do an episiotomy. A clean right mediolateral episiotomy, in other words, cut from the middle of her perineum towards the side, going backwards, away from the anal sphincter muscle. It's a much better option than having a very, very nasty second, third, or even fourth degree tear. So it's a cleaner option and heals very, very well. Now, ideally, you don't want any tearing or just a minor graze. The next option would be a first degree tear. The next option would be an episiotomy or a very small second degree tear. But what we try to avoid is a nasty second degree perineal tear or third and fourth perineal tear. That's the goals when we are managing delivery of the baby's head with the delivery. I hope that information helps, and I'll look forward to speaking to you again soon. Bye for now.